Go.
Come in.
Hi, good afternoon. My name is Yaoska. I'm going to be your nurse today. I'm going to close the door, wash my hands. Can you verify your name and date of birth for me?
Anastasia Bell, 10/20/1996.
Anastasia, do you have any allergies the doctor should be aware about or anything before we begin?
No.
No? Any allergies to latex or anything like that?
No.
No? Okay, perfect. So, what brings you in today?
I've been experiencing pain on the lower right corner of my abdomen
And when did the pain begin?
about 2 days ago.
Okay, and you said it's on your right lower, correct? And does the pain come and go or is it consistent?
It comes and goes.
Okay, and can you describe the type of pain you're feeling?
It's like a pulsing pain.
Pulsing pain. Does anything aggravate the pain, like make it worse?
Usually any heavy lifting.
And does anything like alleviate the pain?
Laying down does.
Laying down. And can you rate the pain from 0 being no pain at all and 10 being the worst pain you've ever experienced?
I'm currently at a 5.
Out of 5. Have you taken anything to alleviate the pain, negative medications at home?
No.
Okay. And is this a pain you ever experienced before?
No, never.
No? Okay. So I'm gonna go ahead and do a head-to-toe assessment on you. Okay, but I have a couple of more questions before we begin, okay?
Okay.
Do you know where you are?
Yes, Mercy Hospital,
Okay. And do you know what year it is?
2020.
Okay. And do you know who our president is?
Trump.
Okay, so patient is ANO times 4. I'm gonna go ahead and take her vitals before we start. Her head-to-toe assessment. Her blood pressure is 120/75. Her respirations are 16. Her pulse is 70, and her oxygen saturation is 99% on room oxygen. So I'm gonna go ahead and wash my hands, put on some gloves. Okay, I'm gonna go ahead and ask you, do you have any difficulty hearing?
No.
No? Okay, do you wear any hearing aids or anything of that sort?
No.
No? Okay, I'm gonna go ahead and check your ears if that's okay with you.
Yes.
I'm gonna look for any drainage, any leakage, any redness in her ear. Okay. Okay, it's fine. Okay, so I'm gonna go ahead and check your mouth. Do you have any dentures? Do you have any like metals in your mouth, like any retainers or anything?
A permanent retainer.
You have
Yes.
permanent retainers. Okay, can you go ahead and open your mouth for me? Say ah.
Ah.
Stick out your tongue. Okay, tummy's nice and pink. Her tonsils are good. They're not enlarged. Can you move your tongue side to side for me? Okay, perfect. Close your mouth. Her lips are inconsistent with her skin tone. Can you go ahead and swallow for me? Okay, her trachea is midline. I don't see any signs of goiter or an enlarged thyroid. I'm gonna go ahead and feel for your lymph nodes. Okay, good. There's no palpable or enlarged nodules. I'm gonna go ahead and do check your vision. Do you wear any glasses or any contacts?
No.
No? Okay, so before we began, we did the Snellen chart and her visual acuity is 20/20. So I'm gonna go ahead and shine the light over your eye. Can you keep looking at me? Okay, so pupils are equal, round, reactive, and light accommodation. Okay, so I'm gonna need you to follow my pen, but don't move your head, okay?
Okay.
Okay, so let me go ahead and check under here. Okay, good. I'm gonna go ahead and have you smell something. So can you close your eyes for me? Okay, can you smell this?
Alcohol.
Okay, perfect. So throw that away. Do you feel my hands on your face?
Yes.
Okay. Can you smile for me? Can you frown? Okay, perfect. Can you sit up for me? Okay, so I'm gonna go ahead and check your cap refills. Okay. Okay. In less than 3 seconds. Okay. I'm gonna go ahead and check your radial. Can you turn your head to the side? My hair rotted. Good. Good. Okay, I'm gonna check for any JVD on both sides. Good. Do you have any trouble breathing or anything of that nature?
No.
No. Do you have any heart condition or anything?
No.
No. Okay. So I'm gonna go ahead and listen to your heart now.
Okay.
Okay. So I'm gonna start at your second intercostal space on your right side. Should be listening to your aortic, where S2 is greater than S1. On your left side, second intercostal is your pulmonic. S2 is greater than S1. On your third intercostal sphinx on the third side, on the left side, would be Erb's point, and S1 and S2 are equal. Fourth would be tricuspid. S1 is greater than S2. Okay, and then at midclavicular left side is the mitral or the apical, and S1 is greater than S2. And I would listen for a full minute and note that the rate is normal. Pulse is 72 and the rhythm is normal as well. Do you have any trouble breathing or anything like that?
No.
Okay, so I'm gonna need you to, when I say breathe in, take a deep breath in and then let it out, okay?
Okay.
So breathe in, breathe out, 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 breathe in, breathe out. Okay, I'm gonna go ahead into the back. I'm gonna look at the overall symmetry of the back, look for any masses or anything. Her spine is correctly aligned. So breathe in, breathe out, 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 breathe in, breathe out. Okay, perfect. Okay. Woo. So I'm gonna go ahead and turn your legs to the side. I need you to do something for me, okay? Okay. There we go. So I'm gonna need you to go ahead and flip your hands like this, okay? As fast as you can. Ready? Go. Okay, good. Now I need you to bring your right heel to your left shin and slide it down. Okay, and then your left heel to your right shin. Bring it down. Perfect. Can you stand up for me?
Yes.
Okay, put your feet together. Okay, put your arms out. Okay, so she has a little bit of sway, which is normal. Okay, you can open your eyes. Can you walk over there and come back?
Yes.
Okay. Your gait and balance is good. You can have a seat. So I'm gonna go ahead and test your reflexes now. Okay. Loosen up your arm. Okay. Okay. Sorry. Okay. Perfect. You can go ahead and lay down again. So I'm gonna go ahead and check your abdomen, okay? Is that fine?
Yes.
Okay. So I'm gonna expose your abdomen. I'm gonna go ahead and look at the overall abdomen, look for any distension, look for any bruising or any surgical scars or of that nature. See if there's any distension and any visible masses. I don't see anything. And you said the pain was on your right lower, correct?
Yes, ma'am.
Okay, so I'm gonna go ahead and listen to your ball sounds. Okay, so I'm gonna go ahead and percuss. If you feel any type of pain, let me know. I'm looking for any dull or tympanic sound. I'm gonna palpate now, okay? Okay. Let me know if you feel any discomfort. Okay. I'm gonna go ahead and listen to Rory. Check for any Rory. Okay, good. And I wanted to ask, before I forget, when was your last bowel movement?
2 days ago?
2 days ago? Okay, and was it normal for you?
Yes.
Yes. And it was like, have you noticed any change in the color of your bowel movement, or in the consistency of it?
No.
No? Okay, so how often do you go?
Usually 2 to 3 times a day.
Okay, so having it be 2 days ago being your last bowel movement, this wouldn't be normal for you, correct?
No. Yes.
Okay.
Correct.
And what about your urination? How often do you go?
I usually go 3 to 4 times a day.
Okay. And have you noticed any change in the odor, in the color?
No.
No. What about in the consistency of it?
Everything's normal.
Okay. Have you had like a stinging feeling when you go to urinate?
No.
Okay, perfect. So I'm gonna go ahead and check your legs now, okay?
Okay.
So I'm gonna go ahead and look at the color of her legs, and look at the hair distribution. Okay, look for any redness. Okay, I'm gonna look at her calves for any redness or swelling. Do you have any pains in your calves?
No.
No? Okay. I'm gonna check your cavity fills on your toes. Okay. Can you go ahead and push your toes for me? Okay. Strength is good. I'm gonna go and check your popliteal, your dorsal pedis. Okay. Can you go ahead and bring your knee up? Okay. Bring it up. Okay, good. I don't see any edema. Okay. Or any skin breakdown behind the heels of the feet. Okay. And can you go ahead and bring your feet together and then separate them for me really fast? Okay, and bring it back. Okay, perfect. And one more thing before I forget, I have to go ahead and listen to your carotid. Okay?
Okay.
Can you turn your head that way?
Yes.
Okay. Turn your head this way. Okay, I don't hear any breaths. Okay, so I'm gonna go ahead and document my findings. I'm gonna wash my hands. Now I'm gonna let the doctor know everything I found, okay?
Okay, thank you.
Okay, thank you.